Hi, everybody. Welcome to another episode of I Am Patient. I'm your host, Brenda Snow, and I am glad to be with you today, Thursday, December 10th. For those of you at sundown, happy Hanukkah, or if you're another part of the world where that's already happened, happy Hanukkah and happy holidays to all of you. I might be back to share one more holiday message before we sign off for 2020. And what a year 2020 has been. You see this lovely gentleman on your screen right now. He is the Senior Director of Research and Insights for the Snow Companies. His name is David Reisner. And hi, David.
Hi.
How are you?
Good. How are you?
I'm great. I'm in a really good mood today and excited to see what you have for everybody. So let me just remind all of you that we started I Am Patient, which is now an award-winning little web chat series, back when the pandemic started. And you may recall that we produced a public service announcement with people from, all over the world, all walks of life, all cultures, really saying, flatten the curve, stay at home, wear the mask, protect people like all of us who are immunocompromised. Since then, we've seen the pandemic kind of quiet and come back raging with a vengeance all over the globe. I saw something this morning that was really sobering. From a US perspective, the biggest amount of deaths they went through. So, 9/11 was there on a single day. The Battle of Antietam was there on a single day. And unfortunately, in third, fourth, fifth, sixth position was COVID. The largest amount of deaths in the history of our country have subsequently been on one single given day in the last week. So this is affecting all of us, and it is affecting you and people that you love. And my heart goes out to you for those of you who have lost family members. I know that I have friends who have been mourning, and this is awful. So we always want to think of ways to kind of provide inspiration, hope, knowledge. And David and his team did another survey. So again, you might recall that we had his colleague Shamel Evans on back in maybe May, I think, and she shared the results from the first survey we did about the impacts of COVID-19 on patients and their families living with chronic or serious medical conditions. And we wanted to say, what's happened now? Like, let's take a look at how people are feeling 6-7 months later. So David led a very large patient study, close to 1,000 patients. And we'd like to share the results with you today. So David's going to talk to you. He's going to show you some slides. I think he's going to be about 15 minutes or so, and then we can come back and have a chat. But you'll want to watch this important information. And for those of you who have participated in this survey, in this study, we thank you. And again, we'll be bringing more information like this to you in 2021. So David, thanks for this important information. Talk to me about it. Tell me what it was, who we talked to, and why this is relevant.
Of course. Well, first off, thank you so much for having me here today. It's such a pleasure to be here. And just to kind of take a quick step back, I want to just describe how my team and I approach research, because I think that's really important to understand sort of how we get to what we get to in this survey. So we really look at transforming that patient data into actionable narratives to help sort of tell that story and better represent you, the patient community. I think that's so important to just start with that. And I also want to remind folks that these aren't just numbers that we're talking about here, right? These are our neighbors, these are our family members, people in our community, people who are continuing to look to us for answers in managing their chronic conditions during these unprecedented times. So first, we triangulated our approach to research by including 3 key sources of information. First, the secondary research to assess the current landscape. Second, we did 2 longitudinal patient surveys that Brenda mentioned. So the first in April during the initial impact of COVID, and then again in August as reopening and post-local mitigation strategies began to sort of relax a little bit. And then finally, we used social listening tools to assess patient sentiments online and reveal some of those conversations taking place amongst the patient communities. So Because of our close relationship with patients, we were able to quickly obtain this meaningful feedback from almost 1,000 patients. Many of you, I'm sure, watching this webcast are likely participants in that survey. So thank you so much for being a part of these efforts. We're able to do this in a fairly short amount of time, about a week or so, and our sample consisted of men, of women, and we made up a wide range of ages. We surveyed folks across urban, suburban, and rural areas across all 50 states. It was also really important to us that we included a diverse representation of perspectives, and multiple ethnicities were included. That was really important for us to ensure a fair representation of the patient community in our country. And most importantly, these individuals represent a wide swath of disease states and conditions, everything from oncology to neurology to immunology and even rare diseases. We're at a really interesting position living through this unprecedented global catastrophe. At the beginning of the pandemic, people were simply focused on doing what they needed to do in order to get past this. The mindsets are changing though, and people are beginning to realize that unfortunately this is our new reality, and they're shifting their approach accordingly. The bottom line is this: patients are concerned, just like all of us, what the future will hold. Yet with that uncertainty, people are now starting to navigate some disruptions of COVID-19 and adapting with some novel solutions. We're starting to get back to some sense of resumed normalcy by managing chronic conditions with a combination of in-person and telehealth visits. With that said, I think the bigger issue that we're seeing is the prolonged financial impact. And unfortunately, these concerns are exacerbated when we looked at communities of color. The economic despair is so difficult that it's forcing patients to make the tough decision between prioritizing essential bills and paying for treatment. And patients aren't taking advantage of some of the current financial help that's out there. On another note, mindsets are changing. People are creatively leveraging virtual means of interaction. In my opinion, this will continue to be essential in fostering that meaningful patient-to-patient connection, which I know I don't have to tell you guys is so critically important. However, with that said, there is a cautioned willingness to begin engaging in small public events, assuming things like proper safety measures are in place. I mean, just like all of us, people are getting sick and tired of looking at the same four walls. There were three key areas that we really dived deep into understanding in this study. One, the effect of COVID, both in terms of the emotional toll and the financial impact. Two, the shift to telehealth. And three, enabling those patient interactions. Since the beginning of the pandemic, patient anxiety levels have increased by almost 59%. They're concerned with what the future will hold, both in terms of COVID-19 and regarding their treatments for their chronic illness. They're feeling isolated, and they're having to prioritize their physical health over seeing people who they love. And unfortunately, I think we can expect this problem to continue as we start to move into the holiday season, where we traditionally gather with, groups of our family and our friends. Another concern for people is that COVID is hitting close to home. 72% of respondents knew someone who fell ill from the disease. And, if we were to look at those numbers today, again, those are back from about August or September. Unfortunately, I would argue to say that those numbers have probably increased.
Yeah.
Again, when broken down, we can see the real disparity in communities of color. By the end of the summer, we really started to see the financial toll that the disease has taken. In August, 56% of patients reported a real financial burden versus about 33% when we first surveyed in April. Our most vulnerable populations are at risk. Almost 1 in 4 patients had to make tough decisions between paying for essential bills and foregoing treatment. Let that sink in. 1 in 4 patients. Now, moving on to another topic we mentioned, the impact of telehealth. Telehealth's widespread adoption has fostered a new virtual relationship for the patient. When surveyed, approximately half were willing to continue using it as an alternative to face-to-face appointments moving forward. You know, there have been some challenges. Patients are having issues with the technology, and doctors' offices all use different platforms. And there's not really anyone designated to help them troubleshoot those types of problems. Like with any new technology, there are some issues that certainly still need to be worked out. But though cautious, patients are looking to find safe ways to engage their communities as we start to look at reopening. And of course, I know that that looks different in every local sort of locality across the year. And as you see Brenda sort of showing, PPE is incredibly important. I can't stress that enough. But again, with that proper precautions and that personal protective equipment, patients are willing to go out of their house and re-enter the communities in smart ways. And with that said, you know, people are also embracing technology in a new and more enhanced way. Patients identify digital and virtual initiatives that are needed to help fill those gaps, including things like virtual patient programs, online resources, and ways to connect with other patients, either by phone or virtually. And I think that's why platforms such as I Am Patient are so important. So as we move into 2021, there's no doubt that it's going to be different. But I'd argue that patient engagement is going to be more important than ever. And just like our patients, we need to learn to adapt and find novel solutions to help meet their needs. And we need to bring patients to the forefront so that we can understand these things and really be able to identify gaps in their experience.
Great. David, that's really important information. Thank you so much for sharing it. And I feel like I should conduct the rest of the interview in a mass, but I'm alone. There's never anybody around. Tell me, was there any bit of findings that really stood out to you or that you didn't expect?
Yeah, you know, for me, I think the biggest thing that I keep coming back to is the inequities when we look at different populations of folks. I think you're seeing it across the board, but COVID has really highlighted that this year. And I think for me as a researcher and, you know, for us as an organization being the leaders in the patient engagement space, it's our responsibility to take that on and our responsibility to help partner and understand with these different patient communities of where we're missing the mark and how we can move forward. So for me, I think that was surprising and is just so critical and something that I think, you know, we'll really be taking on as we look into 2021 is to really understanding, now that we know this is a problem, right? What can we do about it? How can we, you know, how can we action that learning and make it something to help improve this inequity that undoubtedly exists?
Yeah, clearly. I mean, it is a big passion, you know, of mine too. So that's not only what Snow can do in a small way, but I think, you know, holding industry up to, you know, a high aspirational, like this is something you need to do. And I think at all levels, people making sure that if they need to write letters to their congressmen, their senators, you know, there's multiple ways that we need to work on changing this. I think for me, which is also really profound, is the financial impact. I mean, that is a huge burden. And we know that, you know, that there's been in the United States and outside of the United States ways that governments and societies have tried to give emergency funds to families, but, you know, those have run out. Those are run out. So, you know, what are some ways that, you know, if people have forgone taking their medication, what are some ways that they can get the drug costs maybe covered or supplemented to get back on treatment?
Sure, I think that's a really, really great question. So I would say sort of two different groups that I would recommend contacting. First would be your insurance provider. I would start there and see sort of what's available and what sort of help is out there, but also the manufacturer of your particular medication or your product. Oftentimes there is support out there. There's copay assistance, things of that nature. And if you do a little bit of digging, do a little bit of online research, you can certainly be connected to those sorts of organizations or the sort of nonprofit arm of the manufacturer who may be able to help with some of that copay assistance. And I think, you know, if you are struggling, know that there is help out there, and, you know, continue searching, because I think it's so critical that during these times we continue our efforts in terms of being on our treatments and things like that for everyone out there living with a chronic condition.
Yeah, those are great places, David, and I agree. And so everybody, sometimes your physician's office may have a case manager that can help you. The insurance company are great if you are insured. If you are not insured or underinsured, David is referring to patient assistance programs, PAPs, PAPs, so patient assistant programs. And for any of you that have a chronic illness that we're taking a medication, usually things like in oncology, biologics, you know, these are, as you know, I take one, they are non-trivial, they're expensive, but there are certain financial parameters where you can get partial pay, like David's talking about, up to free coverage of the drug for a period of time. So the hardest thing is when you feel crappy, you know, pushing and trying to find out and navigate where these are, but they're out there. And then again, you know, if you have, you know, like I have multiple sclerosis, lean into, as David said, the Multiple Sclerosis Society, the Epilepsy Foundation, you know, whatever disease, chronic illness you or your family member have, try to work with the larger nonprofit that supports those patient communities, because again, they might also have some case managers and some experts on staff to help you navigate where to go, okay? So that's important to do. And, you know, the thing about all these products is they don't work if you don't take them, right? And what I think, you know, I can speak for David and myself, what we don't want to see is anybody get worse or get sicker because of a financial constraint. So please reach out and do that. And if there's any kind of emergency situation you have, type it in at the bottom of Facebook and I will review all these. And if I need to help point you in the right direction, we'll do our best, or have one of my case managers call you. So David, I know, you know, you felt it, I felt it, I think everybody's felt it. The statistic that breaks my heart in that deck is the anxiety. Was it like 12% to 60% increase? I mean, massive. So people are stressed.
For sure. I think there's something called ambiguous loss, right? Where all of us are losing regardless of you know, where you are. COVID has impacted undoubtedly the way you live your life and your daily routine, and that stress certainly is felt. And I think, you know, one really great solution or sort of mechanism to help with some of that stress is making sure you're taking care of yourself. And as folks living with chronic conditions, that's even more so important. So making sure you're eating healthy, making sure you're getting enough sleep, you know, doing all of those things that we know are good for us, right? And I think if we're really able to do that and we focus on hunkering down, staying socially distanced through this winter, vaccines are on their way. If we really just hang tight this winter, I think you know, we're on the up and up, but we really need to hunker down and, you know, again, recognize that these are not just numbers. These are our people. These are our friends and our family. And that's who we're doing this for, right?
Yeah, absolutely. And I think it's also important, everybody, what David just said, you are our friends and our family. And if you have tremendous anxiety, depression, or feel at loss, please reach out to the appropriate places to get help, okay? I know that, that isolation can be totally overwhelming, and we want you to be beacons of hope. And this too shall pass. It might be another few really, really tough months, but this too will pass. David, what's next? What do you envision for like the third research project in regards to COVID that you want to tackle and take on with the team? What are you thinking?
Yeah, sure. So I think, a lot of these three key areas that we kind of went into in the first and the second survey, we now know that these are trends. These are kind of things that are here to stay. So I'm interested in diving a little bit deeper there. And again, trying to find solutions, right? So now that we know that this is sort of the prolonged way that life will be, how do we find solutions? How do we continue to help the patient community? And how do we ensure we're being equitable too? I think that's really important. I really want to make sure we're digging in to all of those different nuanced communities as well.
Well, David, thank you so much. This is important information. I can't wait to, see the next survey get written and fielded. So again, if you want to participate, everybody, we will let you know through this web chat and all the other ways that David does this. I don't know, I'm not the research guru, but David does. And if you'd like to participate, I'm sure we'll have a way for you to help. All right, so what's your holiday message for everybody? Tell us something positive.
Holiday message. I think more than anything, I would just urge people to recognize that this holiday season is going to be a little bit different, right? And, there may be some sense of loss or of traditions and those sorts of things, but just remember that who you're doing this for, who you're socially distancing yourself for. It's for your friends and family members so that we can have additional years to celebrate. So I think that would be my one thing. 2020 was certainly a year. We're starting out fresh. We've got 2 weeks, or I guess a little over that to go, but utilize that as an opportunity, right, to start out fresh and give yourself sort of a new start. I think it's safe to say we've all had a really tough year, and a new start would be, something we're all looking forward to.
That's great, David. Thank you so much. And to all of you, thank you for supporting I Am Patient this year. I was laying in bed this morning thinking, how many guests have we talked to? How many people have we reached? So I'm getting the answers to those, and I'll hit you up. I'm going to have a year-end message just from me to you, and I'll let you know that. But I really appreciate your support, your candor, your questions, your sharing of your time. And most importantly, I appreciate the heart that all of you bring to this. It's what fills my cup up every day, I can assure you. It's very much how I'm driven and motivated. So, hey, listen, this is not a political statement. This is not taking away of your freedoms and your rights as a human. This is a public health issue. This is a public health crisis. So let's do our part, and with kindness and thoughtfulness, inspire everybody to keep these on and get through this shitty thing called COVID-19, so that by, hopefully mid-time of 2021, this is something, again, in our rearview mirror. So until a couple weeks from now, as we get close to after the Christmas holiday and right before New Year's Eve, I'll come back and I'm going to read you something very funny to come into the new year. And until then, this is Brenda, along with David and everybody else that works on I Am Patient, wishing you a happy holiday season. We love you. Take care.
Holidays.
Happy holidays. Bye-bye.